So today is December the 1st, 2016, and yes, I'm driving, and why I decided to do this now, I'm really not sure, but I guess I figured no time better but the present to start this journey with this video. So the day before Thanksgiving, about a week and a half ago, I went for pre-op testing for my weight loss procedure at St. Vincent Hospital, Carmel in Indianapolis. My surgeon will be Dr. Margaret Inman. Had a couple of meetings with her so far. Seems like a very nice lady. She is very sweet, very supportive so far. So went for my pre-op testing just to make sure that everything was up to snuff and was so that I'm not gonna croak when I go for the surgery. I'm going to be having the biliopancreatic diversion with duodenal switch, which they will also be doing a gallbladderectomy due to the amount of weight loss. Usually people have gallbladder issues very shortly after, so they are going to also get rid of that so that I don't have to deal with that later. Pre-op testing was interesting, kind of rough just because you can't eat after midnight. 2.5 hour drive to St. Vincent, then blood work. I was lucky because my doctor had already ordered some of the tests, so I didn't have to do a few things, but most of the time it requires blood work and other lab tests, urine samples, and several other things. Then you have an ultrasound basically of everything, an EKG stress test, pulmonary function test, which I did not have to do because I've already done it, and a chest x-ray, and then an x-ray of everything else, then also an upper GI scan, basically so that the surgeon can map out the route that she's going to do the surgery prior to the surgery. That was done on Wednesday last week, so I am currently waiting for a surgery date, because when I met after you have all the tests done on that day, you'll then meet with the the hospital doctor, and they go through all the test results with you. The test results were all fine that she could see, so they were just waiting on some of the vitamin levels to come back and make sure those were okay, and the surgeon to give the final go-ahead to schedule, and they'll schedule the surgery. Supposedly should still be within the next couple or 3 weeks, so I'm looking forward to it. Nervous, excited, but anyway, my starting weight is approximately 360. I dropped some weight off of that during my nutrition classes, and then had some medicine changes, so unfortunately I actually gained a little bit back because I was on some steroids, and well, that's what steroids do, so happy joy for me. But either way, I'm off of those now, so hopefully I'll probably drop a little bit between now and surgery time, and then when surgery happens, then that's when the fun begins, I guess. So Anyway, this is just my first video, my progress going. I'll have some pictures and stuff too to go along with each one of my videos, and of how things are going. And if anyone is considering this, granted I have not had surgery yet, but I can tell you that the St. Vincent Carmel, the bariatric center, is amazing so far. They've been really nice, very helpful with the nutritionist, and helpful with the food journaling, and with all the stuff that had to be sent to the insurance. The one girl's name is Whitney, that does all the insurance work for Dr. Inman. She was amazing, very helpful, helped me get everything together, submitted everything, and I was actually approved the very first time it was sent in, which does not always happen. So if you start going through this and you're denied, don't give up, give it another chance, because there were several people that I was in some of my classes with, support groups with so far, that have had issues and were denied, and then after doing an appeal and getting the extra information they wanted, ended up passing through and getting approved. So it's just a matter of some insurances, I think, trying to do scare tactic, and so they don't have to pay out money. But in the long run, they're going to be paying less than paying for medications and long-term care and stuff that I would end up needing if I don't get this taken care of right away, because, well, something's got to be done quickly. So anyway, I guess that's all for now. Again, I'm looking forward to everything in the beginning of the journey, and I will be posting another video the day of my surgery, and then I'll try to keep up from there. I'm not good at this, so I'll do my best. See y'all.